Hi guys, welcome to our gross anatomy lecture series. Today we're going to talk about the anatomy of the kidneys, renal anatomy. Right. So, human body has two kidneys, a right kidney and a left kidney. These kidneys they are located up in the abdomen, and you're going to have your right kidney being lower than the left kidney. Why? Because if you were to look at this place, what is found here? Your liver. And we said that the right lobe of the liver is bigger than the left lobe of the liver. So that makes the right kidney to be lower than the left kidney. And another interesting way to differentiate these two kidneys is that the left kidney is high, yes, it is also tall and slender, while the right kidney is bulk, broad, and short. Good, right. So a kidney, what is its main function? We know from renal physiology, it is used, it is actually important for excretion, metabolic excretion, urea balance, so urea excretion, acid base balance. Exactly. So there are so many activities that takes place in the kidney. Right. So a kidney is going to be surrounded by posteriorly. It's actually going to be sitting directly on the posterior abdominal wall because it is a retroperitoneal organ. So actually, you're going to find that it's going to be covered by peritoneal in the anterior portion, right? As we're going to see very soon. So you can actually see that this is a fat layer, and the kidney actually sit directly on the posterior abdominal wall um, along these fat layers. So let's take a look at a cross section of a kidney. What do we see? A kidney is surrounded by a capsule, what you call a fibrous capsule. So right here, this is your kidney bean shaped. This is your hilum. We're gonna look at it later very soon. Um, what surrounds the kidney is your fibrous capsule, and then from the fibrous capsule, you're actually going to have what you call your perirenal fat. Your perirenal fat can also be called your perinephric fat, and this fat it actually communicates with the other side, right? So within this fat, you can actually see the inferior vena cava and the abdominal aorta, and then it will be extending to the other side of the other kidney, right? So you can actually see this is what we call your perirenal fat. And then you're going to have your kidney being surrounded, both the kidney and the suprarenal gland, they're going to be surrounded by this fascia, which we call renal fascia. You can actually see this renal fascia, right? Good. The renal fascia is a continuation of your fascia transversalis. So your fascia transversalis, it actually sort of like divides and then it encloses your kidney like this and extending as the renal fascia. So the renal fascia is an extension of your fascia transversalis. Good, right. And then in the posterior abdominal wall, like we said, the kidney sits in the posterior abdominal wall. There's going to be a fat layer, mainly found in the retroperitoneal space. That is what you call your pararenal fat. Your pararenal fat. You understand? That's amazing. So, in summary, moving from the kidney going outside, you're going to have your fibrous capsule, your pararenal fat, your renal fascia, which is a continuation of the transversalis fascia, and then your sorry, this was your perirenal fat, and then your renal fascia, and then your pararenal fat. Good, let's take a look at uh, let's take a look at the structure of the kidney inside. Right, so the kidney is actually bean shaped, right, and it's going to have a hilum. So it has a convex surface, and then a concave hilum. Here on the hilum, that's where you have structures leaving and entering your kidney. We're going to look at it as we're going to talk about the blood supply of the kidney. But for interest's sake, you're going to have, and from anterior to deep, you are going to have face what you call the renal vein. From the renal vein, you're going to have your renal artery, two of them, right? You can actually see these renal arteries, two of them, right? And then you're going to meet what's called the renal pelvis that will later continue as your ureter. And then you're going to meet lastly another branch of the renal artery. So the renal artery has three branches. The first two branches, they are between the renal vein and the renal pelvis. Then the last branch is actually posterior to all the structures, right? So you're going to have a cortex, right, and a medulla. And then within the medulla, you're going to have these what you call renal pyramids, right? And then they're going to uh, you have an apex and a base. So the base will be continuous with the cortex, and the apex will be what's called the renal papilla. So whatever filtration that is happening here, right, everything is going to be drained via the renal papilla, entering these minor calyx, right? So you have numerous minor calyx, right, and these minor calyx will actually join and form what you call major calyx. So there are about 2 or 3 major calyx, and then the major calyx will unite and form this renal pelvis, right? So take note of this. You have a hilum, and within the hilum, you actually have what we call a renal sinus. So a renal sinus is not the same as a hilum, right? But it's a space, especially that is straight, and that's where the renal pelvis is occupied. So the renal sinus is the place where you find the renal pelvis, and it is full of it. You understand? Good. Now let's take a look at the relations of the kidney. Right, in terms of the costal cartilage that protects the kidneys, you have to understand that the left kidney is higher than the right kidney. So you can actually see this is your left kidney, which is actually higher than the right kidney right here. Your left kidney right here actually higher. So you're going to have, since your left kidney is higher than the right, you're going to have rib number 11 and rib number 12, right? At the left, posterior to the kidney, rib number 11, rib number 12. And for the right kidney, since it is lower, you only have the rib number 12, forming the coastal protection of the right kidney. So left kidney, we have 11 and 12 because it's higher. Right kidney, we only have 12. Very interesting, right? Good. Now let's take a look at the relations of the kidney, anterior relations of the kidney. So the kidney is actually, since it is posterior, you're going to have a lot of viscera, right, that attaches to the kidney. So some of these viscera that attach to the kidney, they're going to be sitting directly on the kidney, and some are going to be separated by a layer of parietal peritoneum. You understand? So anterior relations, depending, let's start with the right kidney. The right kidney anteriorly, okay, let us look it in this way. Right, so like I said that some visceral organs, they sit directly on the liver, on the kidney, and some they leave a peritoneum, right? So this right here is a right kidney. What is anterior to your right kidney? So you're actually going to have your suprarenal gland, your supra right renal gland in the anterior of portion of your kidney. You're going to have a portion of the liver. What lobe of the liver? That's your right lobe of the liver. Remember, we saw the renal impression on the visceral surface of the liver. So you have your liver right here, and since your liver is surrounded by peritoneum, it leaves actually a peritoneum like this. And then you're going to have what you call the right colic flexure. There's going to be an ascending colon right here, and then as it curves to the transverse colon, it is actually in contact with the liver, leaving this space right here. So this space is for the right colic flexure, right? And then you're going to have medially, you're going to have your second part of the duodenum sitting on the hilum of the liver, right? And then lastly, you're going to have your small intestines. Your small intestines are everywhere, right? Because they'll be moving and moving exactly. So you actually find your small intestines here. Let's take a look at the left kidney, which we said is higher, tall, and slender. And posteriorly is covered by 12, 11, and 12 ribs. So definitely you're going to have your suprarenal gland on top, right? And then you're going to have, remember, the stomach is actually the kidney is actually the upper part of the kidney actually forms the stomach bed, remember. So since the stomach is an interperitoneal organ and the spleen, they'll actually leave this parietal peritoneum like this. And then you're going to have your pancreas, right? Remember, your pancreas is related anteriorly to the kidney. And we said that the head, neck, and body of the pancreas, they are actually retroperitoneal. So they'll actually leave a base surface on the liver, on the kidney like this. And then we are going to have, here we have our right colon colic flexure. Here we have our left colic flexure and the descending colon. And we know that the descending colon is a retroperitoneal organ. So actually it also leaves a bay, attaches directly to your kidney. And then we have a portion of your jejunum, your small intestines again, leaving this peritoneum. Good. So those are the structures that are anterior to your kidney. Let's take a look at the structures that are posterior to your kidney. Now, let's take a look at the posterior relations of the kidney. Right here, this is your right kidney and your left kidney. Posterior to the kidney, first we said, the right kidney, you're only going to see the 12th rib. But as for the left, you're going to see the 11th, the 12th rib, since it is higher. So from the 12th rib, below the 12th rib, you're going to have your subcostal nerve, right, with the subcostal artery, right? They'll actually be posterior to both of your kidneys. And L1 nerve, right? Remember, the L1 nerve is gonna terminate as the iliohypogastric and ilioinguinal nerves. So the iliohypogastric and ilioinguinal nerve, they will actually be behind or posterior to your kidney, right? What muscles are posterior to the kidney? Definitely you have the diaphragm, you have the origin of the transversus abdominis, you have the quadratus lumborum muscle, and also you have the psoas major muscle, right? Those are the muscles that are posterior to your kidney. So these relations, they are actually the same as the other kidney, and the only difference being the ribs. Good, the ribs, right? Left kidney, 12 and 11. 11 and 12. Right kidney, just 12. Done. Let's take a look at the blood supply of your kidney. Right, before we look in the blood supply and venous drainage, let's just take a look at this interesting diagram. So we have cut here and removed the skin. So this is how we have exposed our kidney. So remember the structures that I said they were posterior to the kidney. You can actually see this is your subcostal nerve, which is T12. This is your A1 nerve, right? You can actually see your A1 anterior rami that will become your iliohypogastric and ilioinguinal nerve, right? And you can actually see this is your quadratus lumborum, right? You can actually see, and then this is an aponeurosis of your transversus abdominis. Good, right? So the blood supply to the kidney, right here, that is this is your abdominal aorta. At the level of L2, it's gonna give your renal artery. So this is gonna be your left renal artery. This is gonna be your right renal artery. Take note, the right renal artery is longer than the left renal artery, right? And the right renal artery is actually posterior to your um, inferior vena cava, right? When the kidney, when this renal artery reaches the kidney, it's actually gonna give it three branches per se, and the remember we said the structures in the heel of the kidney moving from anterior to posterior. You're going to have your vein, right? So you're going to have your renal vein, right? And then you're going to have two branches of your renal artery, and then you're going to have your renal pelvis, right? And then lastly, you're going to have the last branch of your renal artery, right? That's very good. So this is your renal artery, good. And then blood supply, venous drainage, right? You're going to have your right renal vein and your left renal veins, right? And take note of this: the left renal vein is the one that we said when we're doing the spermatic cord, right? The testicular artery, actually the right testicular artery drains directly into the inferior vena cava. You can see right here, and the left testicular artery, testicular vein drains via the left renal vein, right, and the later drains into your inferior vena cava. So that's it about the venous drainage, right? As for lymph vessels, lymphatic, so the lymph, they are gonna be accompanied with this renal. They are gonna accompany the renal artery, and they're gonna drain in lateral lumbar lymph nodes. Lateral lumbar lymph nodes, right? And then take note, as for your innervation, the kidney only receives sympathetic innervation, does not receive parasympathetic innervation. So the researches says that the kidney receives sympathetic innervation, doesn't receive parasympathetic innervation, right? So that's everything that you have to know when it comes to your liver and when it comes to the kidney, right? Thank you so much. Take care.